Hello there. My name is Dr. Carlo Oger, and I am the Medical Director for the Emergency Department at Cartersville Medical Center. For those of you who do not know, September 13th is the National Sepsis Awareness Day nationwide, and the month of September is Sepsis Awareness Month. So, the hospital quality leaders and myself decided to create this short video to both enhance the awareness and the knowledge of all medical providers about sepsis. Every 3 to 4 seconds, someone dies of sepsis. Despite the fact that sepsis affects more than 1 million Americans each year and kills up to half of them, fewer than half of all the Americans have ever even heard the word sepsis. Those at high risk for sepsis include people with weakened immune systems, infants, children, elderly people, people with chronic debilitating illness, and those who suffer from severe burns or physical trauma. Patients who develop and survive sepsis have an increased risk of complications and death later, and they face a higher healthcare cost and long-term treatment. When you are asked to think of a patient with sepsis, what image comes to mind? Maybe this? Well, after watching this video, I want you to look at this picture here and think of sepsis just the same. Sepsis is a potentially life-threatening complication of an infection. Sepsis occurs when chemicals released through the bloodstream to fight the infection actually trigger an inflammation throughout the body. Next, a cascading effect may occur where organ systems may become damaged and begin to fail. If sepsis progresses to septic shock, a person's blood pressure drops dramatically, and this may lead to death. The most important step to treating sepsis is to recognize it early so that critical interventions can be started and lives be saved. Sepsis is actually a continuum of disease and begins with SIRS, Systemic Inflammatory Response Syndrome. SIRS is defined as 2 of the following criteria: hypothermia or fever, low or high white blood cell count, tachycardia, and tachypnea. If you have just 2 of the signs just mentioned before, and the healthcare provider suspects, yes, you heard me right, just a suspicion of infection, and 2 of the latter signs and symptoms is defined as sepsis. Consider this for a moment. A 19-year-old female patient presents to the emergency department for the evaluation of fever and has a heart rate of 95 and dysuria. This patient, by definition, is septic. If this same patient has evidence of end organ damage, then this patient has severe sepsis. So what are the signs of severe sepsis? One of the key indicators of severe sepsis is the elevation of blood lactate levels. It is defined as a value of 4 or more in the past, but just recently the threshold for diagnosis has been lowered to 2, as to increase the sensitivity to both diagnose and treat sepsis. Other indicators include, but are not limited to, respiratory failure like hypoxia, hematologic findings like low platelets, elevated INR or DIC, encephalopathy and altermentation, liver dysfunction as evidenced by elevated liver enzymes, kidney injury defined as oliguria, low urine output or electrolyte abnormalities, heart injury like heart failure and hypotension. Septic shock is the most severe of that continuum of disease of sepsis, and it is defined as severe sepsis with hypotension that does not resolve after proper IV hydration. Now this is very important. What does proper IV hydration mean? 30 milliliters per kilogram is the correct IV fluid doses for a patient in sepsis, and at Cartersville Medical Center, we are treating all our potentially septic patients with this IV hydration bolus dose. It is the failure of the blood pressure to improve after completion of these fluids that defines septic shock. So do not be surprised if you start seeing orders for large quantities of IV fluids on septic patients, even if they have a history of congestive heart failure. So far in this video, we've learned the definitions of SIRS, Systemic Inflammatory Response Syndrome, sepsis, severe sepsis, and septic shock. And even if that's all you learn from this video, then we're already winning the battle against sepsis. Like I said before, the key to improved outcomes is the early recognition, to decrease our mental threshold to consider sepsis as a diagnosis and to order the proper diagnostic tests and initiate prompt, adequate treatment. Now, we already talked about IV hydration, so now let's talk about something that should come as obvious to all of us: antibiotic treatment. For every 1 hour in delay to antibiotic administration, the mortality of sepsis goes up by 7%. This means that antibiotic administration should be done immediately upon considering sepsis as a diagnosis, even if you don't know the source of the infection. So, now that you've learned about sepsis, start saving lives. If you suspect sepsis, i.e. you have abnormal vital signs as defined above, and the suspicion of infection, tell a doctor caring for the patient and insist on initiating the sepsis bundle. This includes the necessary test to diagnose severe sepsis and includes the treatment with IV fluids and antibiotics. Do not accept a half-done sepsis bundle. Insist that antibiotics be started also, as this will decrease the morbidity and the mortality of your patient. I hope that you have found this video both helpful and, most importantly, that it will increase your awareness of sepsis and diagnosis tests and treatment guidelines associated with this diagnosis. I would leave you with this one thought: know the signs, know sepsis, and save lives.